So familial platelet disorder with associated myeloid malignancies has been linked to germline RUNX1 disorder since about 1999. And we know that these patients have a very rare disorder that is comprised of quantitative and qualitative platelet defects and a predisposition to heme malignancies. And so most patients have myeloid malignancies, some have lymphoid malignancies. And we wanted to understand the outcomes for patients with germline RUNX1 mutations. And so we undertook an analysis with the CIBMTR, and we identified in their database 330 patients with both somatic and germline RUNX1 mutations from 98 centers who had received an allogeneic transplant between 2013 and 2020. And in further analysis determined that approximately 22 of them, or 6.7%, did in fact have germline mutations. We then wanted to look at the outcomes comparing these two groups of patients, the somatic and the germline patients, and we found that patients with germline mutations were more likely to have multiple lines of therapy, to be primary induction failure, and overall, they were more likely to be relapsed and refractory with MRD positive disease going into transplant. So it was very interesting then that when we further evaluated the data and we looked at the participants who already had received a complete response when they went to transplant, then that difference disappeared. And so the impact of the study was really identifying the prevalence of germline RUNX1 mutations in this large cohort, and then explaining their outcomes, whether they were in a complete response or not. And so I think that this data would need to be further validated in a prospective study with multivariate analysis, but I think it's an exciting start.